Hi, I'm Dr. John Fluke. I've devoted my career to helping doctors find the latest cutting-edge products and techniques to give their patients the best clinical results possible. However, the doctor is only half of that equation. Patients need to be able to maintain those results by keeping them clean between office visits to ensure success. Today, I'd like to show you a product that can make flossing easier for patients in situations where standard floss and flossing techniques just won't work. If you're a patient with an implant, a bridge, an implant-supported denture, or wired orthodontics, flossing can be difficult, or for some patients, practically impossible. Flossing is critical to removing plaque that contains bacteria, which can cause even the best dental treatment to fail, and that plaque needs to be removed frequently. But how can you get the floss to go where it needs to go into those difficult areas? Well, folks, say hello to a product that can help solve that problem. This is the AutoFlosser. It's a simple and easy to use device that gets floss into hard to reach areas so that you can clean them thoroughly. Let's take a look at it together. So let's open it up. First thing you're going to come across is this little card that says, don't run out of floss. And as a dentist, I highly recommend you don't run out of floss. But the great thing about this is it does say, go to www.theautoflosser.com, which is the website where you go to order. And the floss that is made for the AutoFlosser is specifically made for the device. And I highly recommend using it. Just go to the website, order more, never run out. You'll also have these instructions, a quick start guide. And I like this a lot. It's really simple. You open it up, every step is numbered. It's also got lots of little drawings on it that are really easy to understand, that are well done. So if you ever have any questions, keep this around as something to reference. It's always handy. We'll take the foam rubber out. The next thing you're going to find is this little travel bag. It's a zippered case, and it's a great way to take the AutoFlosser with you wherever you go. So now we get down to the AutoFlosser itself, and this is everything that you're going to get and everything that you're going to need. So the first thing we're going to start off with is the AutoFlosser. Let's take it out of the box and see what it is. So this is the AutoFlosser itself. Rotate it here so you can see it. It has this little thumb wheel or control wheel on the top of it, and the floss actually comes out through this tip. Now what's great about this is it's designed so that you can use it from both the top and the bottom, and let me explain to you what that means. If you get into a situation or you happen to be more comfortable with the tip giving you the floss while it's pointing in the top direction, all you've got to do is hold the tip, twist the handle, and then rotate the handle around, and then twist it again, and now it's locked in the other direction. So now you can feed the floss through in an up direction, and if you want to have it the other way, once again, you simply twist, turn, lock, and you've got it going in another direction. So it's really easy to use. Everybody's mouth is a little different, and because of that, the AutoFlosser comes with two different shaped curved tips. This is the one that comes on the device out of the box, but if you've got an area in your mouth where maybe this particular design will reach better, all you've got to do is take one off, lock that one on, and you're ready to go. Floss has two ends. One end is fuzzy, and one end is what we call the leader, which is kind of like fishing line. And you will put the leader into the hole, feed it in, and then rotate the wheel. And the wheel will grab that leader. And as I turn it, you'll notice the floss is going into the AutoFlosser. And at the other end, as you rotate that wheel, the leader comes out. Now, there's two types of dentures that can be held in implants. Some of them can be removed and taken out and cleaned, but in some situations, a dentist will actually permanently attach the denture to the implants, and that denture can only be removed by a dentist. So if you happen to be a person who has a situation like that, and here you can see through this clear acrylic, we've got 4 implants, one here, one here, one here, and one here. And there are little screws here that permanently attach that denture to those implants, and you can't take this out at home. But the thing about dentures and anything in the mouth will build plaque. And even though you don't have teeth any longer, you still build plaque under the denture and around the implants, and you need to keep that clean. You'll notice on this particular example, we have a little notch here, one in the front and one on the other side. And those little notches are there to help get floss through to clean under them, because cleaning with floss is the best way to do that. But it makes it easier if there's a little bit of a notch there to go through. But even if you don't have a notch, the AutoFlosser is really great for this, because what it allows you to do is put that leader up under the denture and then feed the leader through. When you get enough, you take hold of it, pull some floss through, and then you can work that floss back and forth under the denture to where that implant is. And when you get to that spot, you can then clean the implant. So you just floss against it, just like you would a tooth. And then you would move on further back and to the other side. But having the AutoFlosser with the ability to take that leader and then get that leader to feed under that denture makes it much, much easier. If a denture is never cleaned, you'll get plaque and other debris built up underneath here, and it can cause infections, it can cause pain, it can cause the implants to fail. The AutoFlosser works well if you happen to have any bridge work in your mouth. And what a bridge is, I'm going to turn this so you can see it from the side, and you can see through the clear acrylic here that there is a tooth missing in this space. And oftentimes in dentistry, when you're missing a tooth like this, we'll do a bridge. So what that is, I'll take it off here and I'm going to turn it so that you can see it. We shape the teeth on either side of the space, and then we have a bridge made, and we fill it full of cement, and we place it onto the teeth. And then what this does is this replaces that missing tooth, and it gives you chewing efficiency again. So even though you're missing a tooth, it's like you have one. The only thing is, because this middle tooth is attached to the one behind and in front, you can't bring floss down into that area and clean properly. But you still need to clean the back of this tooth. You need to clean underneath the false tooth, what we call the pontic. And then you need to clean underneath the bridge on the back tooth. So this is a great use for the AutoFlosser. So what you'll do is, I've got a fresh lead here. We're going to feed that through, and then we can feed enough through that you can get a hold of it. And move the AutoFlosser back, and you pull until you get some clean floss through here. And then you can do the C shape again on the front of the back tooth and then underneath the false tooth. So the AutoFlosser is designed to help you get floss between the teeth in areas that you can't reach from above. And orthodontics is a great example of that, because if you have wires, and in this case we've got a model that is set up to show orthodontics, these brackets are bonded to the teeth, and then we have a band that actually goes all the way around the tooth and is cemented into place. And flossing in these areas is really impossible to do without getting under the wire, because you want to get clear down around the gum line, and obviously you're not going to be able to do that with the wire in place. So this is one of the indications that the AutoFlosser really shines in. So what you'll do is you go in and you take the leader. I've already got this one set up to feed, and you will simply turn the wheel and bring the leader through the tooth or through the area between the teeth. And then when you get enough leader to pull or hold, you pull it forward. And I've got to hold on to this model since it's not attached to a body. And when you get to that point, then you can take the AutoFlosser back and you can then do what we call C-shaped flossing, which is moving the floss back and forth, pushing it towards the tooth and away from the tooth, getting the tooth behind it. So let's talk about cleaning the AutoFlosser. A lot of people will say, well, you're putting floss through it, and you're sometimes pulling floss back through it. Doesn't it get dirty? And the answer to that is, if it gets dirty, it is really easy to clean. So what you do is you simply rotate the handle and take the tip off. And then you've got this area that has the wheel. Underneath that, these little ribbed pieces. And what you do is you just push up on those little bumps, and the mechanism pops right out of it. So you get the mechanism out, and this is actually where the floss goes and how the floss goes through it. So you open it, it's on a hinge, and you can run this under running water, flush it out, clean it all up, then let it dry. And after it's dry, you just close the lid, put this back in the top, press down, it'll click into place. You put the tip back on, and you're ready to go. The AutoFlosser is a great way to help keep your teeth and dental work free of plaque. If you've made an investment in your oral health, the AutoFlosser can help protect that investment. Find out more and order the AutoFlosser by visiting AutoFlosser.com. I'm Dr. John Fluke. Thanks for watching.